Genital herpes medication. Acyclovir. Pronounced as acyclovir. Why is this medication prescribed? Acyclovir is used to decrease pain and speed the healing of sores or blisters in people who have varicella, chickenpox, herpes zoster, shingles, a rash that can occur in people who have had chickenpox in the past, and first-time or repeat outbreaks of genital herpes, a herpes virus infection that causes sores to form around the genitals and rectum from time to time. Acyclovir is also sometimes used to prevent outbreaks of genital herpes in people who are infected with the virus. Acyclovir is in a class of antiviral medications called synthetic nucleoside analogues. It works by stopping the spread of the herpes virus in the body. Acyclovir will not cure genital herpes and may not stop the spread of genital herpes to other people. How should this medicine be used? Acyclovir comes as a tablet, a capsule, and a suspension, liquid, to take by mouth. It also comes as a delayed-release buccal tablet to apply to the upper gum of the mouth. The tablets, capsules, and suspension are usually taken with or without food 2 to 5 times a day for 5 to 10 days, starting as soon as possible after your symptoms begin. When acyclovir is used to prevent outbreaks of genital herpes, it is usually taken 2 to 5 times a day for up to 12 months. The delayed-release buccal tablet is usually applied with a dry finger as a one-time dose within 1 hour after itching, redness, burning, or tingling cold sore symptoms begin but before the cold sore appears. Take or use acyclovir at around the same time, every day. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take or use acyclovir exactly as directed. Do not take or use more or less of it or take it more often or for a longer time than prescribed by your doctor. Do not chew, crush, suck, or swallow the delayed-release buccal tablets. Drink plenty of liquids, if you have a dry mouth while using the delayed-release buccal tablets. To use buccal acyclovir, follow these steps. Find the area on the upper gum above your left and right incisor teeth, the teeth just to the left and right of your 2 front teeth. With dry hands, remove 1 delayed-release tablet from the container. Gently apply the tablet to the upper gum area as high as it will go on your gum above one of your incisor teeth on the side of your mouth with the cold sore. Do not apply it to the inside of the lip or cheek. Hold the tablet in place for 30 seconds. If the tablet does not stick to your gum or if it sticks to your cheek or the inside of your lip, reposition it to stick to your gum. Leave the tablet in place until it dissolves. Do not interfere with the placement of the tablet. Check to see if the tablet is still in place after eating, drinking, or rinsing your mouth. If the delayed-release buccal tablet comes off within the first 6 hours of application, reapply the same tablet. If it still will not stick, then apply a new tablet. If you accidentally swallow the tablet within the first 6 hours of application, drink a glass of water and place a new tablet on your gum. If the tablet falls off or is swallowed 6 or more hours after application, do not apply a new tablet until your next regular time. Avoid the following while you are using acyclovir buccal delayed-release tablet. Do not chew gum, touch, or press the buccal tablet after it has been applied. Do not wear upper dentures. Do not brush your teeth until it dissolves. If your teeth need to be cleaned while the tablet is in place, rinse the mouth gently. Shake the suspension well before each use to mix the medication evenly. Your symptoms should improve during your treatment with acyclovir. Call your doctor if your symptoms do not improve or if they get worse. Take or use acyclovir until you finish the prescription, even if you feel better. If you stop taking acyclovir too soon or skip doses, your infection may not be completely treated or may become more difficult to treat. The delayed-release buccal tablet is applied as a one-time dose. Other uses for this medicine. Acyclovir is also sometimes used to treat eczema herpeticum, a skin infection caused by the herpes virus, to treat and prevent herpes infections of the skin, eyes, nose, and mouth in patients with human immunodeficiency virus, HIV, and to treat oral hairy leukoplakia, condition that causes hairy white or gray-colored patches on the tongue or inside of the cheek. This medication may be prescribed for other uses. Ask your doctor or pharmacist for more information. What special precautions should I follow before taking acyclovir? Tell your doctor and pharmacist if you are allergic to acyclovir, valacyclovir, Valtrex, any other medications, milk proteins, or any of the ingredients in acyclovir products. Ask your pharmacist for a list of the ingredients. Tell your doctor and pharmacist what prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking or plan to take. Be sure to mention any of the following: amphotericin B, fungizone, aminoglycoside antibiotics such as amikacin, amikin, gentamicin, garamicin, kanamycin, Kentrax, neomycin, Nesrx, neofradin, paromomycin, Humidin, streptomycin, and tobramycin, Toby, Nebsen, aspirin and other nonsteroidal anti-inflammatory drugs such as ibuprofen, Advil, Motrin, and naproxen, Aleve, naproxen, cyclosporin, Gengraph, Neoral, Sandimmune, medications to treat HIV or AIDS such as Cidovudine, Retrovir, AZT, pentamidine, Nebupent, probenecid, Benamid, sulfonamides such as sulfamethoxazole and trimethoprim, Bactrim, tacrolimus, Prograf, and vancomycin. Many other medications may also interact with acyclovir. So be sure to tell your doctor about all the medications you are taking, even those that do not appear on this list. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor if there is a possibility you may be dehydrated from a recent illness or activity, or if you have or have ever had problems with your immune system, human immunodeficiency virus infection, HIV, acquired immunodeficiency syndrome, AIDS, or kidney disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while taking acyclovir, call your doctor. If you are taking acyclovir to treat genital herpes, you should know that genital herpes can be spread through sexual contact even if you don't have blisters or other symptoms and possibly even if you are taking acyclovir. Talk to your doctor about ways to stop the spread of genital herpes and about whether your partner should receive treatment. Genital herpes medication. Thank you for watching and please subscribe to my channel.